Hi, welcome back to Therapy to the Point. I'm Jeffrey, I'm a licensed therapist, and in today's video I'm going to go over the basics of cognitive behavioral therapy. First, I'm going to explain what cognitive behavioral therapy is. After that, I'm going to explain how cognitive behavioral therapy aims at alleviating symptoms. Cognitive behavioral therapy is a therapeutic modality that combines cognitive therapy, rational emotive behavioral therapy, and behavioral therapy. Cognitive therapy was developed by Dr. Aaron Beck. Rational emotive behavioral therapy was developed by Dr. Albert Ellis, and behavioral therapy was pioneered by Ivan Pavlov, B.F. Skinner, and Albert Bandura, among others. The main premise of cognitive behavioral therapy is that there is this interconnectedness between the situation, our thoughts, our feelings, and our behaviors, meaning that one change to one of these is going to influence the whole cycle. This means that in cognitive behavioral therapy, we use specific interventions for each one of these four categories. Let me explain. In cognitive behavioral therapy, your therapist is going to help you assess what is best to try to change, whether it's the situation, your thoughts about the situation, perhaps your emotions, or your behaviors. Depending on what needs to change, depends on the intervention that will be used. Let's say that you and your therapist decide that the best course of action is to try to change the situation. Then, with the help of your therapist is going to guide you to be able to gain those problem-solving skills. For example, they might help you look at the situation from a bird's eye view. An example of this might be, if this situation was happening to a friend of yours or to an identical twin of yours, what advice would you give them? Typically, that answer helps you problem solve. Your therapist might even guide you to find other people in your life that can help you through the problem that you're going through. It's worth noting that your therapist is not actually going to give you the solutions, but they're going to empower you to find your own solutions. Now, let's say that you and your therapist determine that the best course of action is to try to change your thoughts or how you perceive the situation. Then there are going to be specific interventions such as cognitive reframing, finding the evidence, lawyering the thought records, different things like that that can really help you aim to change your thinking patterns. It's worth mentioning that cognitive behavioral therapy does not try to make you think more optimistically. It simply tries to get you to think in a more balanced and realistic way. If you're working through your thoughts, you might even identify something that are called cognitive distortions or thinking errors, and you and your therapist are able to label these distortions and use specific techniques so that your belief in these distortions doesn't affect you as much. If you and your therapist discuss that the best course of action is to tackle the feelings directly, then you might use techniques such as imagery to evoke the feeling or an emotional response from you. There's a great technique called the empty chair technique that can also help elicit emotional responses. This helps you be more in tune with your feelings. Now, let's say that you and your therapist determine that the best course of action is to modify your behaviors. Then you might see interventions such as behavioral activation, activity scheduling, behavioral experiments, token economies, positive versus negative reinforcement, or interventions that are similar to that. It's worth noting that you can work on two things at once, so you might be working on your thoughts and your behaviors as well, especially when it's a thought that is getting in the way of engaging in a functional behavior. For example, let's say that you want to exercise, but you're having the thought, I'm too tired to exercise. Then you might work through that thought to then be able to get yourself to exercise. This is a basic introduction to cognitive behavioral therapy. I hope you liked it. If you liked this video, make sure to give it a thumbs up. And for more content like this, be sure to subscribe to my channel. Thank you and see you in the next one.